Bacterial vaginosis, often referred to as BV, is one of the most common vaginal conditions affecting women of reproductive age. Despite its prevalence, many people are unfamiliar with what causes BV, how it presents, and the best ways to manage and prevent it. Understanding bacterial vaginosis is important, not only for those who may be affected, but for anyone interested in maintaining good reproductive health. At its core, bacterial vaginosis is an imbalance in the vaginal microbiome. The vagina naturally contains a mix of many types of bacteria, but the dominant type is usually lactobacillus. These bacteria play a vital role in keeping the vagina healthy by producing lactic acid, which maintains a slightly acidic environment. This acidity helps prevent the overgrowth of harmful bacteria and keeps infections at bay. BV occurs when there's a disruption in this delicate balance. For reasons that are not always fully understood, the population of lactobacillus diminishes, and other types of bacteria, especially anaerobic bacteria, multiply. This shift leads to the symptoms and health concerns associated with bacterial vaginosis. While BV is not considered a sexually transmitted infection, sexual activity can increase the risk of developing it, and it is more common among sexually active women. Several factors can contribute to the development of BV. Having a new sexual partner or multiple partners is associated with a higher risk, possibly because new bacterial strains are introduced into the vaginal environment. Douching, a practice that involves rinsing out the vagina with water or other fluids, can also upset the natural balance, washing away beneficial bacteria and making it easier for harmful bacteria to thrive. Even things like using scented soaps, bubble baths, or certain hygiene products can disturb the vaginal flora. Symptoms of bacterial vaginosis can vary. Some women have no noticeable symptoms at all, while others may experience clear signs. The most common symptom is an unusual vaginal discharge. This discharge is often thin, grayish-white, and may have a strong fishy odor, which can be particularly noticeable after sex. Some women report mild irritation, itching, or burning, but these are less common. It's important to remember that symptoms of VV can be similar to those of other vaginal infections, like yeast infections or trichomoniasis, so proper diagnosis by a healthcare provider is essential. Diagnosing BV typically involves a simple evaluation in a healthcare setting. A provider may ask about symptoms and medical history, perform a pelvic examination, and take a sample of vaginal fluid. Laboratory tests can confirm the presence of BV by identifying the specific bacteria involved and measuring the pH of the vaginal fluid. A higher than normal pH and the presence of certain clue cells, vaginal cells coated with bacteria, are strong indicators of BV. The good news is that bacterial vaginosis is treatable. The most common treatments are antibiotics, which may be prescribed in the form of oral tablets, vaginal gels, or creams. Metronidazole and clindamycin are among the most frequently used medications. It's important to take the full course of antibiotics as prescribed, even if symptoms improve before the medication is finished. This helps ensure that the infection is completely cleared and reduces the risk of recurrence. Despite effective treatments, BV can sometimes return, even after successful therapy. Recurrence is common, with some women experiencing repeated episodes within a few months. Researchers are still investigating why this happens, but it may be related to the persistence of certain bacterial strains or underlying factors that disrupt the vaginal microbiome. If you experience recurrent BV, your healthcare provider may recommend a different treatment approach or discuss lifestyle changes that could help restore balance. Why does bacterial vaginosis matter? Beyond the discomfort it can cause, BV can have more serious health implications. In pregnant women, BV has been linked to an increased risk of preterm birth and low birth weight. For women undergoing gynecologic surgeries, untreated BV can raise the risk of post-surgical infections. Additionally, BV can increase susceptibility to other sexually transmitted infections, including HIV, and can make it easier for existing infections to be transmitted to partners. Preventing BV starts with understanding and respecting the natural balance of the vaginal microbiome. Avoiding douching is one of the most important steps, as it can disrupt the healthy bacteria that protect against infection. Using mild, unscented soaps for external cleansing and avoiding fragrances or harsh chemicals around the vaginal area can also help. Practicing safe sex, including using condoms and limiting the number of sexual partners, may reduce the risk of developing BV. For women who experience frequent recurrences, discussing additional preventive strategies with a healthcare provider is advised. It's also important to recognize when to seek medical care. Any unusual vaginal discharge, odor, itching, or discomfort that persists should be evaluated by a healthcare professional. Self-diagnosing and treating presumed BV with over-the-counter medications for yeast infections may delay appropriate care and prolong symptoms. Timely diagnosis and treatment can help prevent complications and improve overall well-being. There are common misconceptions about BV that deserve clarification. BV is not caused by poor hygiene, nor is it a reflection of personal cleanliness. In fact, overcleaning or using harsh products can increase the risk. BV is also not strictly a sexually transmitted infection, though sexual activity plays a role in its development. Understanding these facts can help reduce stigma and encourage more open conversations about vaginal health. Researchers continue to study the vaginal ecosystem, searching for new ways to prevent and treat BV. Probiotics, particularly those containing lactobacillus, are an area of ongoing investigation, though more research is needed before they can be routinely recommended for prevention or treatment. Maintaining overall health, managing stress, and following healthy lifestyle habits may also support a balanced vaginal microbiome. In summary, bacterial vaginosis is a common but manageable condition resulting from an imbalance in the vaginal bacteria. Recognizing the symptoms, seeking timely medical advice, and following recommended treatment can help resolve the infection and prevent complications. By making informed choices about personal hygiene and sexual health, women can reduce their risk of BV and maintain a healthy, comfortable life. Remember, if you have concerns or symptoms, don't hesitate to reach out to a trusted healthcare provider for guidance and support. Empowering yourself with knowledge is the first step toward better health.